The Healthcare.Gov project was a high-profile IT failure in the U.S. government, intended to be an online health insurance marketplace as part of the Affordable Care Act. The project's initial budget of $93.7 million ultimately grew to over $1.7 billion, with some estimates exceeding $2 billion. This presentation will examine the key project management failures, consequences, and valuable lessons learned from this case study. The Healthcare.Gov website interface is shown, with an American flag design element, a professional and clean look, soft lighting, and a blue and white color scheme. The Affordable Care Act, ACA, also known as Obamacare, was a major healthcare reform signed into law in 2010. Healthcare.Gov was a crucial component of the ACA, serving as the primary portal for enrolling in health insurance plans for 36 states. The website was intended to enable millions of Americans to shop for and enroll in qualified health plans. The planned development timeframe was from October 2010 to October 2013, with an original projected cost of $93.7 million. The initial anticipated user base was 50-60 million visitors in the first year. The timeline shows that the initial funding for the Healthcare.Gov project was awarded in 2011, with the launch happening on October 1, 2013. The initial budget estimate was $93.7 million, but the actual cost at launch exceeded $400 million. The final cost ended up being approximately $1.7 billion. The purpose of the project was to develop a federal online marketplace to enable Americans to compare and purchase health insurance as part of the Affordable Care Act. The project timeline and budget information provide important context for understanding the scale and complexity of this government IT initiative. The visual timeline chart helps illustrate the key milestones and duration of the project development. The timeline on this slide outlines the inadequate planning and compressed timelines that led to the troubled launch of the website. In 2011, contractors were awarded funding but received only minimal specifications, setting the stage for challenges down the line. It wasn't until March 2013 that substantial website specifications were finally provided to the developers, leaving little time for implementation. End-to-end testing was delayed until just days before the launch in September 2013, leaving little room for fixes. As a result, the website was launched on October 1, 2013 with rushed, incomplete, and untested features. This timeline highlights how the lack of planning and unrealistic deadlines contributed to the problematic launch of the website. The Healthcare.Gov website launch was plagued by a lack of clear leadership and fragmented governance across the many government offices and contractors involved. There was no single entity in charge, leading to delayed decision-making and poor communication between the different stakeholders. The project suffered from unclear responsibilities, with no clear division of duties among the various parties. The Centers for Medicare and Medicaid Services, CMS, lacked experienced technical leaders to provide strong technical oversight. The HHS-CIO claimed limited authority over the project, and the IT Investment Review Board was inactive, providing little oversight. These leadership and governance issues were a fundamental flaw that contributed to the disastrous launch of the Healthcare.Gov website. The slide presents data on the high-risk contracting and severe cost overruns experienced in a major IT project. The initial cost estimate was $93.7 million, but the final cost ballooned to $1.7 billion over a 1,700% increase. This was due to the use of cost-reimbursable contracts, which meant contractors were paid for all allowable costs regardless of project completion or performance. This contract structure created weak financial controls and contributed significantly to the project's runaway expenses. The final cost exceeded the initial estimate by over 1,700%, making this one of the most extreme cost overruns in federal IT history. These types of cost overruns highlight the importance of implementing strong financial controls and accountability measures when managing high-risk, complex IT projects. The slide highlights the failure to heed internal and external warnings about risks and issues with the project. Multiple warnings from the project team about technical risks and inadequate testing were downplayed or dismissed by leadership. Outside consultants and contractors repeatedly raised alarms about the project's trajectory and readiness, but these concerns were not properly addressed. Despite mounting evidence of unresolved critical issues, CMS remained overly optimistic and committed to the original launch date. This failure to listen to warnings and address underlying risks ultimately led to the project's failure. The rigid organizational culture and poor collaboration between teams were major challenges we faced. Siloed teams worked in isolation with minimal communication, which hindered progress. The culture discouraged sharing negative information, making it difficult to address problems. Contractor feedback was rarely incorporated into decision-making, limiting valuable input. Eventually, we adopted a more collaborative, badgeless culture that proved crucial to the recovery effort. Incomplete system testing led to major issues when the site launched. Comprehensive end-to-end testing was delayed until right before launch. This left limited time to identify and fix critical bugs and issues. As a result, the site was plagued with crashes, errors, and usability problems on launch day. Only 6 people were able to successfully enroll, while millions encountered major issues. These failures highlight the importance of thorough, ongoing testing throughout development. The key challenge we faced was a disproportionate focus on policy and politics, which overshadowed the critical technical needs of the project. On the left, we see how excessive attention to policymaking and political factors meant that core technical requirements and implementation challenges were often treated as secondary priorities. On the right, we see how heavy White House involvement added layers of complexity to the decision-making process, complicating things and diverting focus away from fundamental technical issues. The main takeaway is that the balance was off, with too much emphasis on the political side at the expense of the technical side, which ultimately hindered the overall success of the project. Going forward, we need to strike a better balance between policy, political considerations and the technical realities of implementation. Maintaining this equilibrium will be crucial to the success of future initiatives. The failed launch of Healthcare.Gov was a major crisis for the administration, with only 6 people successfully enrolling on the first day. The site crashed within just 2 hours of going live, a complete disaster. The project's budget ballooned from $93.7 million to over $1.7 billion, a massive cost overrun. This became a national embarrassment, triggering weeks of negative media coverage and congressional hearings. The administration had to assemble an emergency, tech surge, team, including top Silicon Valley talent, to stabilize and fix the site over a 2-month period. We've assembled a top-notch tech surge team of talented professionals from Silicon Valley to lead our emergency recovery efforts. The team has conducted a comprehensive assessment to rapidly diagnose the critical issues and bottlenecks affecting our platform. Based on this diagnosis, we've prioritized the most crucial fixes to be implemented first, with a phased approach to gradually improve overall functionality. Thanks to the hard work and expertise of this talented team, we've been able to dramatically improve site performance and reliability within just 2 months, stabilizing the platform. The key improvements we made after the crisis include centralized leadership, a more collaborative culture, and enhanced oversight. Under centralized leadership, we brought in experienced project managers and replaced underperforming staff and contractors with proven talent. We also adopted a badgeless approach that broke down silos and fostered teamwork across agencies and contractors, eliminating organizational barriers. Finally, CMS implemented more rigorous management practices and contract oversight to prevent similar failures in future projects. These changes have helped us get projects back on track and deliver better results for our stakeholders. The creation of the U.S. Digital Service brought in tech talent from industry to help improve digital services in government, like the Healthcare.Gov crisis. New requirements were implemented for more transparency in government IT projects, including better reporting on costs, timelines, and performance metrics. This has helped increase visibility into the status and progress of major government technology initiatives. The Healthcare.Gov crisis highlighted key lessons for managing complex public sector technology projects. Establishing clear leadership with decision-making authority is critical for project success. Adopting agile, iterative development approaches helps address challenges and deliver value incrementally. Implementing comprehensive testing throughout the development lifecycle is essential to identify and fix issues early. Maintaining robust risk management practices, including mechanisms to address warnings, is crucial for mitigating project risks. The Healthcare.Gov project faced a number of critical issues during its initial rollout, including poor planning, fragmented leadership, weak contract management, and a rigid organizational culture. In response, the government launched an emergency tech surge to prioritize fixes, centralized authority and replaced leadership, improved contract oversight, adopted a more iterative, risk-based approach, and fostered a more collaborative, transparent team culture. This turnaround effort offers valuable lessons for large-scale government IT initiatives: the importance of thorough planning, strong governance, effective oversight, and an agile, transparent organizational mindset. The Healthcare.Gov case exemplifies how poor execution can derail a major project, but also how decisive crisis management and a willingness to adapt can help get it back on track. The key takeaway is that proactive risk management, clear leadership and accountability, and a flexible, collaborative culture are critical success factors for complex government technology initiatives.